Now, what do you think about the IPT, the IPTLD, the targeted low dose?
IPT is a good option.
Okay.
I've seen people who had exhausted everything in conventional medicine and conventional chemotherapy, conventional everything, and they always give that little phrase, "Go home and get your things in order."
Sure.
You know, that's a real doctory thing.
Yeah.
And with the IPT, a lot of these people, instead of getting their things in order, took IPT and got a lot of good results and a good quality of life. IPT is insulin-potentiation therapy. Now they're calling it low-dose chemotherapy.
IPTLD, sure. Can you kind of describe what is IPTLD? What is the low-dose IPT?
Well, the low-dose IPT, the low-dose therapy, has to do with getting the cancer cells, fooling the cancer cells.
Okay.
Cancer cells eat sugar at about 19 times the speed of healthy cells, and cancer cells are voracious for sugar, which you should say that's one of the good management aspects of treating cancer patients is take them off every drop of sugar, okay. not a speck, but with IPT. What you do is you give insulin, and insulin lowers the blood sugar, and you just get the right amount of insulin, and you give it, and you lower the blood sugar below its normal rate of about 90 or 100 milligram per cent, and when it gets down to 40 range, you get really sick. I mean, you feel sick. It's not dangerous, but it feels terrible. It gets dangerous when you get down around 20 or 10 or 0. But at 40, it's not dangerous, but it's quite unpleasant. And what's happened, it's unpleasant for the cancer cells is more because they're starving. Okay. And cancer cells are really good at selecting out chemotherapy. They won't take chemotherapy, but they will take sugar. And when you take away all the sugar, then the cancer cells will take anything. It's kind of like someone dying of thirst on the ocean, in an ocean raft, and they drink salt water. Okay. You know it's not good for them, and it kills them. But the cancer cells then will take the chemotherapy because they can't get sugar. Okay. And that gives a tremendous benefit therapeutically, and the numbers are really fantastic on that because the IPT gives you 200%, 200 or 300% the therapy with 10% of the toxicity. Right. You give a tiny dose of chemotherapy at the therapeutic moment when the blood sugar reaches 40. Okay. You give the IV chemotherapy.
And so that's more of a selectively toxic treatment towards the cancer cells than just blasting the whole body with chemo.
Exactly. That's exactly the way to put it.